Most patients with moderate or severe COVID-19 suffer from at least one symptom months later. This is according to a new report. Here to explain is Dr. Daniel Korytskas, Chief of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily.
These results came out today through one of the American Medical Association's journals. Pretty startling. 73% of patients still struggle with COVID symptoms, things like fatigue, shortness of breath, more than 60 days after their illness. This seems like a high number to us, but is this consistent with what you all have seen at the Brigham?
Well, this is consistent with the information that we've been seeing and with what our clinical experience is. This paper really looked at all of the data that had been published by others following cohorts of people who have had COVID-19. And as the CDC reported even a year ago, there's a surprising number of people who have the long-lasting symptoms. It's another reason why people should get vaccinated, because even if you're young and healthy today, if you get COVID and you even have a mild case of COVID, you might still be left with these lingering symptoms.
To that point, the CDC does recommend vaccination for people who have recovered from COVID. Is there any research at this point to suggest these lingering symptoms could improve after vaccination?
There are tantalizing anecdotes of people who have had so-called long COVID who say that they improve after receiving a vaccine. It's hard to know whether there is really an actual improvement that's occurring, or people merely feel reassured after their vaccine. I'd like to see some more rigorous science done to demonstrate that the vaccine actually does lead to symptom resolution and functional improvement, better breathing and the like.
Yeah, more to watch there. All right, what about this? We're getting some encouraging new information about how long immunity from COVID could last, and it seems like infection plus the vaccine could be a pretty powerful combination. What can you tell us about that?
Well, that's right. We know that if you get vaccinated after having had COVID, your antibody levels get boosted way up, even higher than what we see in people who are getting vaccinated without ever having had COVID. And so the higher the neutralizing antibody levels, the longer they'll last, because it takes that much longer for them to decline below the level of protection or below the level at which they can be measured in a laboratory.
So Governor Baker now saying 77% of the adult population in Massachusetts has received at least one shot. 77%. Do you think that's enough to reach herd immunity?
I think we're getting close. I think it's terrific to see the state leading in that way. I think we have to be cognizant of the populations that we still need to reach to get vaccinated. And I would worry that even if it's a small minority of people who don't get vaccinated, that we could see little brush fires in those populations, just like we see occasional outbreaks of measles or mumps among the unvaccinated. So we should really be aiming for 100%.
All right. Dr. Korytskas, thank you for your time. As always, we really appreciate it.
My pleasure.